Assalamu alaikum. I hope so. You all guys are fine and doing very well. So here we are again in the second wave of Corona, and due to that, we are having again holidays. So this is the best time to utilize basically your holidays. Uh, because the papers are near, and as you know that professional exam dates are 11 February so far if the schedule don't change. So hope so this is the time for this is a high time basically for the preparation of the exams. So I will like that you and me guys we can revise as much as more important topics related to our final year BDS. So starting with the basic chapter today, which is our oral and maxillofacial basically instruments that we use in the our oral surgery departments. Uh, uh, Sometimes a question can come, sometimes question can't come, but this is a basic thing that you need to know. So that's why this is the lecture one of the oral surgery series. So without wasting any time, I would like to show my slide and start our today's lecture. Okay, now let's start. So let me make this the full picture. Now I hope so this is visible to you guys, and okay, this is full screen mode. Now so we will be discussing today regarding the oral maxillofacial surgery instruments. So I hope so this will be useful for you guys. So first comes the instrument which comes in our mind is periosteal elevator. The word periosteal means the peri means around, and osteal means the bone, and osteal means the bone. Elevating means to elevate the basically gingiva or papilla, which is around the tooth socket. So with that, let's see. The periosteal elevator is also known as molt. You can also call it molt. So what is the function? Basically, the function of the periosteal elevator is to detach the periosteum from the bone, forming an incision, or the detach the gingival tissues form around the neck of the tooth prior to the placement of extraction valve. So basically, what is the function? As it is saying that its name says that elevate. So basically, what it is elevating? It is elevating the periosteum, basically reattaching the periosteum from the bone. One thing. Then after giving an incision, basically to detach the gingival tissues. So it is also detaching periosteal and also the gingival tissues from the around the neck of the tooth, which is covering the tooth basically prior to placement of extraction forceps. So you might have seen in the surgery department if you have done your wards that this is a common thing whenever you have to remove a tooth or extract it. Basically, what you do first is that you place an periosteal you place a normal elevator or any other elevator to remove to break down the pedial fibers and to remove the sport of gingival papilla or gingival tissues around the neck of the tooth, so that you can engage your extraction forceps and remove the tooth. So this is basically the function of the periosteal elevator, which is also known as mold. So what are the feature? It is basically double ended with one round blended end and one pointed end. We will see what its feature are. The tray setup used for the most surgical procedure: extraction, gingivoplasty, alveoloplasty, cyst removal. So basically, it is removed for the many surgical procedures. The most commonly include extraction and then gingivoplasty, alveoloplasty, and cyst removal. What is the clinical application? 7A wax spatula or a Woodson 1 plastic instrument is sometimes used if a smaller periosteal reside. So whenever you are requiring a small periosteal elevator, you can also use 7A wax spatula or the wooden one plastic instrument. Let's see how it looks like. This is the periosteal elevator molt. You can see that one end is as it told that there is a one blunted end. You can see that this is blunted end, uh, and on the other side and one is pointed end. Basically this is the pointed end and this is the blunted end. So always remember that the periosteal elevator will have a blunt side like this and a pointed side on the other end. ठीक है? And it is basically double end with one round. So basically this is round and this is blunt, and the other is the pointed one. So it is double ended instrument, one with the blunt end and the other with the pointed one. Okay, I hope so. You can recognize this instrument whenever it comes into your OSPE or any exam in which you need to identify the periosteal elevator. So you can easily examine by checking out its ends. One is blunt and it is rounded. Other is the pointed one, and it is also known as the mold. So its function is, as the name indicates, periosteal elevator. Basically, it will deviate at the periosteum from the ostial from the bone and the gingival tissues around the neck, so that you can engage the extraction forceps and remove the or extract the tooth. Okay, so now moving towards our next instrument, its name is straight elevator. So what is the function of basically straight elevator? So in straight elevator, you see that its function is to loosen tooth or root from the bony socket prior to the placement of the socket forceps. Okay, so what it is saying that it basically it loses a tooth, or the root from the bony socket prior to replacement of decision forces. So it makes the space for the normal. It is making basically the space for the normal extraction forceps, so that it can uh, lose the tooth or root, so that the tooth can be easily extracted. So basically what is doing, it is making the it very easy for you guys to extract the tooth. Now, what is the feature? Feature we will discuss with the picture. Let's talk about the setup. Basically, it is used for the tooth and root extraction, as I told you earlier. Now, this is the picture of the straight elevator. You can see why we are calling it as a straight elevator. Basically, it's the neck and the shank all are straight, and its tips are also straight. If you can see that, the working side is also straight. Okay, what is saying that it has basically straight handle. The handle is also straight. There is no angle or contour angle in it. Now what it is doing, uh, uh, there is a question in our YouTube, and a question is being asked: is there any type of periosteal elevator? Yes, there are a lot of types of basically elevators. We will discuss. Basically, there is no there are some types, the type which has been discussed here is mold. So I will come on the types in the next slides. So do wait for that as well. Okay, now we were discussing the this straight elevator. The features it tolls are saying that a straight hand, it has basically straight handling handle. You can see that in this picture, it has straight handle and straight working hand. Now, what there is another thing, they basically they are paired. So whenever in OSPE an examiner asks you to tell me that these are sorry, oh, I missed the slide. Basically, it comes in sizes of 1, 3, 3, 4, and 301, and it's single rounded working and several sizes. It can come in your several sizes, so you can have in different sizes, small, large, and other. So, what are the crayers? So, basically, crayer is a very important instrument, and as I told earlier, that elevators are of a lot of types. The first one was peri-austral elevator, which was known as mold. Then there was another elevator which we called straight because of its shape. And then this is the angular elevators because it is named due to any angle present in it, and it is known as cryer. Cryer. Basically, cryer means weeping. When you are weeping, it makes you weep as well, because when it is engaged in the socket, it can easily extract the tooth in any angle, which will be hurtful for the patient if you don't have given the local anesthesia. So always do the extraction under the local anesthesia. So function, what is the function? It loosen the tooth or root from the bony socket prior to replacement of extraction forces. Basically, you will note here that all the elevator have one common function, that basically they are loosening the teeth so that we can remove easily, making it easier for the force extraction forceps to hold. Okay, for the removal of the tooth from the socket. Now, what are the features? Basically, the features. that it tells are it handles may be either large or straight or T-bar cross design. As you can see that it can be either straight, it can be either T-bar design, uh, and and they are either large. Then the pointed working end in several sizes. Basically, the working ends are in pointed. You can see that this tip is pointed. And the tips are sharp and pointed. So the working end are being pointed, and they can be of very several sizes. Basically, they are paired. So you need to know which one is the right and which one is the left. This is a tricky question. The examiner can confuse you when he or she will place this in your hands or in the examination tray and let you know that what is this crier, either it is of left side or right side. Then you need to know that there is a trick. You need to know that if it's or if you have or if its tip is in your right side, then it will be the left, it will call the left plier, or if its tip is on the left side, then it will call the right plier, crier. Okay, and it is also called as flag elevator. This is an MCQ, basically an MCQ based question. It can be asked in exam that what type of the uh, elevator it is also known as. It is known as flag elevator as well. This can come in your MCQ. Then there are other common design. It basically it comes in pots and crane and tray setup. Whenever you it is also used for the tooth and root extraction, as I told you earlier, and it is also used for the removal of impacted tooth as well. So I hope so. So far, you guys are good, and you are guys are getting my point. If you do have any questions, you can leave in the comment section. I will try to answer them at the end or after one instrument. So now there is another elevator. The first elevator was angular elevator, which was basically we calling as crier. Then there is another type which is known as pots. So what is the function of pots and what is the picture? Basically, this is a pot picture. You can see that. Its function is to lose tooth or root. As I told you earlier, all the elevator function is basically losing the tooth or root from the bony socket prior to replacement of extraction of teeth forceps. Okay. Then what is the feature? It handles may be either large and straight or T-bar crossbar design. You can see that this is T-bar, showing that it is a alphabet letter T. T-bar design or crossbar designs basically. Rounded working end in several sizes. Basically, the working ends, you can see that these are the working and these are being rounded. Okay. Uh, then then they are basically in several sizes. They are also paired right and left as like the crier. So other common designs are crier and crane. You should know that the both elevators, crier and the pots were in the right and left available, and they were basically paired. And the other thing was crier was called as a flag elevator. Now it is saying that it is also used for the tooth and extraction, root extraction, and impaction. So basically, the crier can be used in the tooth and root extraction as well as the impaction. So this is the basically the angular elevator pots picture. You can see that why it is being called pot, and it has T-shaped bar design and is working and is basically rounded. So this is the two things that you need to know for identification. Now coming to the crane, what is the function of the crane? Basically, the function of the crane includes to loosen tooth or root from the bony socket prior to the placement of the extraction forceps. So what it is saying that you are again losing the tooth or root from the bony socket prior to the placement of extraction forceps so that you can make the extraction easy. What the feature includes? Feature includes it has basically large straight right handle. So it has, you can see that this is a large straight handle as you can see in this picture, and it is non-paired unlike the crier and the pots which we discussed earlier, and it is universal. So basically it can be used universally. Other common design include criers and pots. Okay, as I told earlier, the tray setup include tooth and root extraction for the impaction, same as of the other angular elevators. So you need to know that basically for the identification, it has large straight angle and large straight handle, and the working end is basically a little bit pointed and it is contour angle. Okay. Now coming to the root tip pix angle. Okay. So as the name says, what it telling that it is used for picking a root tip. So it is function is to loosen small root fragment from the bony circuit. So what it is doing, it is doing the small root fragments, loosening it so that we can remove it from the bony socket. What are the feature? Basically, small elevator with thin pointed angle working and or single or double ended. So you can see that it looks similar to the your um, you can see that this is it has pointed, and it is basically double ended. It can be either double ended or single ended, so you don't need to confuse either it is single ended or double ended. It can be single ended, double ended, and it is basically thin. It will be very thin, and it is basically pointed, and it has angle working, and you can see that there is an angle between the working end of these instruments. So you need to know that, and it is that's why it is known as the root tip picks, and it is basically angle, and it is also used for the tooth and root extraction and impaction. Now coming forward to root tip picks straight, as the name indicates, it will be straight. It handle and is working and will be straight. So this is a small elevator with thin. It is basically thin, a pointed straight working end. The working end is basically thin, and it can be either single or double ended. You can see that in this picture it is showing that this is the working end is thin and is pointed and is single ended, and it is also used for the tooth and the root extraction and impaction basically. So now moving forward, we are coming towards curates. There are different curates that you have being studied in the perio department and the third year BDS. Now we come towards the surgical curates. They can be either double-ended and angular, and function is to remove the tissue or debris from the bony socket. So the function of the curates are basically to remove the tissue or debris from the bony socket. So whenever you got these instruments, so the main function is like you have to remove the any debris or tissue from the bony socket. You can see that its pointed ends look similar to our spoon shaped instrument in the which you use for the cavity excavation in the uh, operative department. Okay, so it is basically feature spoon shape. Basically, it is used for scraping, and is also known as scraping instrument. Usually double-ended and angular in several sizes. Basically, it is a angle or double-ended, and it is angular in several sizes. Its function is for the removal of the extraction. It is used basically in extraction, impaction, and cyst removal. And the main function is to remove the tissue and debris from the bony socket. What is the clinical application? It is a use following the tooth extraction to ensure the removal of debris and disease tissue. So it makes the ensurety that all the debris and the other tissue, the disease tissue, has been removed from the tooth socket after extraction. So this is this picture. You can don't confuse it with the spoon excavator that is used in the oral surgery. This is used basically in the uh, oral surgery as the surgical curettes. Okay. Now moving towards our next instrument, which is surgical curettes, and it is also known as mold. A point to remember that you have studied earlier, there was a periosteal elevator. It is also known as mold. It was the type of it. Now what is doing here, surgical curette? Basically, it is removing the tissue or debris from the bone socket. So the functions of the curettes are to remove tissue or debris from the bone socket. However, the mold in the form of the our elevator was what is doing, it was losing the tooth and the bony socket so that you can extract the tooth easily. So its feature include basically it has single-handed rounded work end with a large diameter handle. So you can see that its working end is with large diameter, and it has a large single-handed the your grasping handle. And then what it is basically used in the extraction, impaction, cyst removal. Clinical application includes the mold number one picture, basically this, also used to retract the tissue flaps following incision. So whenever you give an incision for the removal of the tooth, you can also use it for retracting the tissue flaps as well. Okay. Now coming towards the hemostat, as the word hemostat means that you need to stop the blood if it is coming from the bony socket or other any artery, you need to basically clamp it so that the blood stop. So its function is to secure the small hold a small item like gauze or tissue, like gauze or cotton, and then you need to clamp the blood vessel. If any blood vessel is leaking blood, you need to stop it by clamping it and remove small pieces of tooth or bone. Whenever you remove a tooth, some pieces of the tooth are being broken down, the bone is being destroyed, or there's some parts of the bones are being left in the socket. You need to remove it with the help of hemostat. There are different sizes of the hemostat and names, like common name include mosquito and Kelly, which we will discuss. It can either it can either be angled or a straight with locking scissor-like handles. So there is a basically a question that comes in examination: what is difference between the hemostat and the uh, scissors-like handles? Uh, so you need to know that differences includes their working ends and the locking and unlocking features. So these can be are available in different sizes as told in this slide. In the straight setup, basically they can be used in all surgical setups. As I told earlier, in the clinical application, you can see that a ratchet type handle requires some practice to open and close smoothly. Very versatile instrument used in areas of memories. Basically, they can be used in everywhere for the coagulation of for the clotting for making the blood stop. Basically, hemostat for doing the function as hemostat. You can see the both of the hemostat are basically the lock and unlocking one, and they have straight working end. Now what should be, and this is a needle order. This is basically a very important instrument that we need to be discussed in the oral surgery, and we often come in contact during our any simple or other complex surgery for the suturing. Basically, the needle holder's function is to hold suture needle. So it is basically holding the suture needle as when you do suturing. You can see that it has a space here for the holding of the sutures, and these are some of the uh, thing design that is being made here. Similar to the hemostat, basically it is similar to the hemostat, but with a concave area on the inside of each beak to allow for the curve of suture needle. So you can see that difference between the hemostat and the difference between the needle holder is that this concave area which is present inside for the holding of the needle, suture needle. Uh, However, it is not being present in the hemostat. So hemostat can't be used to for the in the suturing and grasping the suture needle. At way setup, in this way, in any surgical procedure involving incision will require placement of suture. Basically, any suture that requires uh, uh, any incision which in any surgery in which you give incision, you will require suture. So you need the needle holder to be present in your way so that you can suture it up. Then the clinical application include to avoid needle breakage. Okay, so whenever you place it, you need to avoid the needle breakage. Place the needle holder on the needle just beyond the suture attachment point at the right angle to curve the needle. So this was one of the point. You can see that this is a needle holder. This is mostly exam in the exam. In it can come in your OSPE, and you need to identify it. There are 2 points that you can with the help of which can you can identify it easily. You see that this is long handle needle holder. So it will basically long handle, and there will be locking feature in it present, and its beak will be very short, and inside you will see that it is concave, and there will be a curve present like this for the holding of the suture needles. Okay, now what are the sutures? So sutures are a very important thing. You have been studying throughout your dentistry. Suture, what the function is suture? Basically, its function is to close incision. It hold the tissue in place during the healing. Whenever you have extracted the tooth, then you need to close the bony socket with the help of the sutures. So suture material attached to sterile stainless steel needle. Basically, the needle which is being used is it is sterile stainless steel needle, and its material the spread of the suture is being attached to it. It comes in different sizes and designs of needle. Suture may be absorbable and non-absorbable. So you should always remember that this is basically a suture needle, and this is suture thread, and it is being held by the suture holding needle, as we discussed earlier, there are basically different types of suture. This is one of the important viva question as well as of the theoretical question that you need to know, that it is either absorbable and it is non-absorbable. It is always asked in exam. So you should know what are the absorbable sutures and what are non-absorbable sutures. Absorbable sutures includes plain or chromic gut. Uh, as you can see that this name tells you chromic gut. Gut includes like your body, and it can be absorbed in the body. Polyglycolic acid, PGA, Vicryl. Vicryl, mostly most of the time we use in the clinic is Vicryl for the absorbable suture, and most of the time we use in clinics the silk as a non-absorbable suture. There is other polyester, nylon, polypropylene. So basically, it can come in your exam as a viva question or as a theoretical question in the MCQ or in your SEQs. So you should remember that these are the types and what includes them. Then there is size by diameter of suture material. There are of different gauges: 30, 40, 50. Common size used in the range. Most commonly we use 30. We can use another. So basically, small number is equal to large diameter. So this is 30 has basically it is small number, but it is having the large diameter. So clinical application include non-absorbable suture unusually remove at the 7 to 10 days post-surgical visit. In the clinics, whenever we remove a tooth, we usually give non-absorbable suture like silk and to the patient and call him after 7 to 10 days ठीक है, after so that when the tooth bony socket has been healed, then we remove these non-absorbable suture. However, the absorbable suture are absorbed within the socket and then not need to be removed. And these are being placed with the needle holder or hemostat as I told earlier. So this is the suture needle and these are the suture material. This is silk. Silk, you should know that it is non-absorbable, so it needs to be removed after 7 to 8 days of the extraction. So what is scalpel? Scalpel is a very common thing that is being used in the surgery department. So it is used for the cutting soft tissues. As you should remember, S means scalpel means surgical knife, and for cutting the soft tissues, its features include often referred to as Bart Parker. So you can see that in this picture there are different types of the blades being used. One is straight and one is a little bit angled and one is this like this. And so this is basically the scalpel. This is a holder of the blade. Okay, so it is often referred to as Bart Parker or BP as well. Okay, you should remember that this as well. Individually sterile wrap for single use. Basically, it is used for single use and it is individually sterile. Common blades includes number 11, number 12, and number 15. Basically, there are different types of the sizes of the blade, which include this is number 11, this is number 12, and number 15, which you can attach on this holder here. It is basically of metallic and it is sterilizable handle for the replacing the blades. Basically, the it is of metallic and its handle is being sterilizable and with the replacing blades you can use it in your clinical practice. Disposable scalpel consisting of plastic and handle with attached blade. You can see that this is disposable for the one use only. Other you can sterilize it. Tray setup, which is basically used in the most surgical setup in the impaction, in the extraction, in biopsy, doing biopsy, in perineectomy as well, in gynecoplasty, alveoloplasty, incisions, advantage and epicosectomy. Okay, so these are some of the procedures in which this is used in biopsy, in infection, in extraction, in splenectomy, ठीक है, in gingivoplasty, in alveoloplasty, incision, drainage, and epicosectomy. Okay, so clinical application includes for a safety blades and are placed and removed from the metal handle with a hemostat or a specially designed scalpel blade removal. So always remove the blade from the blade holder, scalpel, ठीक है, with the help of a metal handle with hemostat or either the specially designed scalpel blade remover. Okay, so you should remember this thing. And use blade should be disposed of in a sharp container. So basically, use blade should always be disposed of in the sharp containers. So you can see this. These, if this is a blade you have used, so you should remember to remove them in a sharp blade container always. This was number 11. This was number 12, and this one number 15. You can see that in number one, it has straight, so one is straight, two is a little bit rounded, so 12 blade is a little bit rounded, and number 15 you can see that this is a little bit bent, so this is number 15. So the holder is also known as BP Braid Parker, Bart Parker, and as I told you, these are sterilizable, and the blades are for the single use, and you need to uh, again dispose of in the sharp containing instruments. Okay, what is scalpel blade remover? To safely remove the blade from the scalpel handle. So basically, this is a scalpel blade remover. You can easily remove them from the scalpel handle. Now, rounded side cutting. So, what are basic rounders? You we need to study that to cut and contour the bone remover sharp edges of alveolar crest after extraction for better contour of alveolar ridges, removes exostosis. So basically what it's doing, it is basically cutting and contouring the bone, as you can see that, and it has a sharp edges, so it removes the sharp edges of alveolar crest as well. After extraction for the better contour of alveolar ridge, remove the exostosis. So it is removing the exostosis after the extraction, and it's basically contouring the alveolar ridge. So it is cutting and contouring the bone after the extraction, and it is basically contouring the better alveolar ridge and removing the any exostosis. So it is known as rongeurs. Okay. Side cutting picture is this, and its features are includes the scissor type. Basically, it is scissor type. ठीक है. It is basically it is scissor type and handle and has cutting edges on the top of the beaks. So basically, the beaks are of cutting edges, and the working end, and this is the scissor handle, and the handle. You can see that these are known as long gears. Okay, so these are basically used in multiple extraction, alveolectomy, alveoloplasty. Clinical application includes during the use, bone will accumulate around the cutting edges. Assistant should wipe the working end with the 4 and 4 periodically to remove the debris. That during the use, we need to we need the bone will accumulate around the cutting edges. Okay. Now coming towards the our next thing, this is Ronger end cutting. One was the side cutting, the other was the end cutting. So end cutting is this function is same as the side cutting, and the feature are on the same as well. Everything is same. Just you need to know the picture of it. Then we have bone chisel and mallet. You have seen the chisel because it is removal for is used for removal of any tori to remove the bone from the better contour of alveolar ridge to remove exostosis tori. So with the help of the bone chisel, like this is the chisel and this is mallet. With the help of chisel, you can remove any bony tori and can contour the alveolar ridge basically very good. So this was all about the bony chisel and mallet, and it is used in tori removal or alveoloplasty. Okay, so anyone can ask what is the function of the chisel and mallet. This is mallet and the bony chisel. So they are being used in the surgery department for removal of tori and alveoloplasty. Okay. Then there is bone files. So you will come in contact with these very much in your wards or in your departments. It is used for smoothing the bone for better contouring of the alveolar ridge and often following use of ringer. Whenever you use the ringer, you use following after it, and it is basically used for smoothing of alveolar bony ridge. And it can be either straight or curved working, and you can see that this in this picture is a straight, and there is curved bony ends, and it basically the cross cut or straight cutting ridges. It includes cross cut or the straight cutting ridges, and it is basically double ended. So basically, it is also double ended, and this setup it can be used for multiple extraction and impaction that requires the bone removal, tori removal alveoloplasty. So during use, bone will accumulate around the cutting edges. As I told you earlier, I think the assistant should wipe off the working and four multiplier periodically to move the debris. Okay. Then we come to tissue scissors, tissue scissors, which is also known as DEAN, which is used to remove the cut and remove excess or diseased soft tissue. Also used to cut sutures after knots are tying during the suture placement. As self-explanatory it is. What is featured includes other common varieties of tissue scissors include Kelly and Iris. In the tray setup, you can see that it is used for the gingivectomy, gingivoplasty, freenectomy, and multiple extraction. So it can either be used for gingivectomy, for removal of gingiva and gingivoplasty, as well as freenectomy and multiple extraction. You can see that this is the picture of the uh, tissue scissor, and it is being okay. And tissue scissor, this is iris. So what iris is a little bit longer than the this our dean. So iris is to cut and remove excess disease soft tissue, same as the earlier one had. Also used to cut sutures after knots and tied during suture placement. Same, it can be either straight or curved. You can see that this one is the straight as well as the curve, and this is iris basically. Other common variety of tissues is dean and iris. Okay, and it is also used in gingivectomy, gingivoplasty, freenectomy, multiple extraction. So now coming towards Kelly, which one is our, I guess, the last tissue scissor, and it is function are the same as earlier scissors, and it can be either straight or curved. You can see that it is straight in this, and this is curved a little bit, and it is okay, and it is also used for the gingivectomy, gingivoplasty, freenectomy, multiple extraction. Then coming towards the suture scissors. So basically, suture scissors, as the name indicates, they are used for the removal of the sutures, for cutting the sutures. After extraction, one curved hook-like tip. Basically, one is the one you can see the, if it can be large. This is one end is curved and hook-like tip. Hook it includes the hook here and to secure the plastic and rubber tubbing to webs. Okay, and the suture hold suture away from the tissue while cutting. Basically, hold the suture away from the tissue while cutting so that the tissue is not being cut again. Now, no, next thing is tray setup. It is there in the tray setup they are used for suture removal. Suture removal often performed by the dental assistant. Basically, the dental assistant perform the suture removal. So the surgeon should wipe the area clean with moisture. Two curved scissor beak under the suture near the knot. Then grasp the knot with a cotton plier or hemostat and pull the suture out. Okay, as I told. Then there are towel clamps. What are the towel clamps doing? They are used for to securing the webs and to secure plastic and rubber tubbing on webs. So basically, these are used for securing webs and plastic and other. It has sharp prong tips. You can see that these are the sharp prong tips. And additional move use is to remove the metal crowns, temporary metal crowns, which are being given in the children. Any procedure when head are draped to a slight surgical area. So these have prongs, and these are known as the towel clamps as well. Then there are tissue retractors, which are very much common. Austin is the very much famous in this. The function of the tissue retractor is to deflect the periosteum from the bone following an incision. So whenever you give an incision for the mole of a tooth, the tissue retractor helps in retracting the periosteum and deflect it. And its features include L shape. Basically, it is an L shape. You can see it looks like L with one rounded end and the one forked one. Basically, the one is rounded and you can see then the one is the forked one. And common design includes Austin Selden. It can be used in all surgical procedure for the retracting the tissues. You can see in this picture, this is another tissue retractor and it is known as SEN. So what it is saying that using like this is also fork and one end is also rounded. So it is double-ended with one rounded. You can see that this is rounded and the other end is the forked one, and it is also used in all surgical procedure and in the main function is tissue retracting and deflecting the flap or papilla. Tissue retracting periosteal elevator Selden. So to deflect and retract the tissue flap from the bone following incision. It is also double-ended with round and blended, and you can see that this it includes both rounded and so both rounded and one is the tissue periosteal elevator Selden. So used for the most surgical procedure, including the extraction, gingivoplasty, alveoplasty, and cyst removal. Now coming towards the tongue and cheek retractor, Minnesota. This is very much common. You can see in your OSPI table or in Viva exam, in bench exam, and you will be come in contact with this. You should know that this is Minnesota. Other common design include Schumann and Vader. Basically, it is used for holding the tongue and the cheek away from the surgical site so that they don't get damaged for holding the tongue and the cheek away from surgical site. It is used also used in the all surgical procedure. So what is this? This is tongue and cheek retractor Schumann. I know that these names are difficult for you guys, but you will practice pronunciation and watch them 2 or 3 times. You will know remember these names. Schumann. So it is also used for holding the tongue and cheek away from surgical site. Another common name includes Minnesota wider. It is also used in surgical procedure. So you can see that this shape like it is pulling away the cheek, protecting it and tongue. And there is last one I think so, Weider, tongue and cheek retractor. It is also used for holding a tongue and cheek away, and is also used in surgical procedure. So these are basically all the tongue and cheek retractors. Then what is mouth prop and pipe block? You can see that this is mouth prop and pipe block. What are they doing? They are doing that to keep the mouth open with extensive procedures sedated or disabled patient. So when you ever you have given a patient sedated drug or you are uh, doing a practice on a disabled patient, you need to give them mouth prop or bite blocks uh, so that their mouth is being opened. Don't they don't close their mouth. Feature includes sterilizable. Basically, these are sterilizable rubber block in the four sizes for children and adults. Other common designs include mouth gag. So these are sterilizable, and they can use any procedure when the patient has difficulty keeping the mouth open. You can use in any patient which has difficulty in mouth opening. So to keep its mouth open, you can use the mouth prop bite blocks. And there is another thing, mouth prop, mouth gag. So what is mouth gag? So you have seen this instrument. This is known as the mouth gag. It is used for the keeping the mouth open with extensive procedure. It is already several procedure. So it includes HF design with the rubber tips. Other common design includes a bite block or at that face setup includes any procedure when patient may have a difficult keeping mouth open. Okay, so then we have a surgical aspirating tip bite self cleaning. It is used for maintaining a clear working field by removing the saliva, blood, debris. As the name indicates, it is used for self-cleaning, so it will be remove the saliva, any blood, and debris. Uh, Tray setup includes all surgical procedure. Feature include built-in stylet to clear the tip of the bone with tooth fragments available in several diameters. Other common design includes facial cogs. Well, it is not very much commonly used. Then there is another surgical aspiration tip, Cogswell, to maintain a clear working field by removing the saliva, blood, and debris. Vacuum relief hole controls the blood friction by uncovering the hole with fingertip. Other common design, Byred Frazier, all surgical and is used in all surgical procedure. Clinical application glue tips are cleaned with the long, flexible cleaning brushes. So, okay. I need to cover this. These are very much slides, but I will try my best to cover as much as I can. Now moving towards the surgical aspiration tip. This is also used in the Yankee tonsil aspirator. See this. This is basically used in general anesthesia and for the suctioning the throat, and it's angle with perforated ball type end for suctioning throat. So basically it has angle and ball type end for suctioning the throat, and it is used in general anesthesia. Now moving towards the tissue pliers, there are Adapson. This is very common. This is being used to grasp and stabilize the soft tissue flaps during the sutures and reconstructive procedure such as gingival grafting. During the gingival grafting, you need to use adjacent tissue flare because it will grasp the soft tissue flap and during the suture and in the certain procedure like gingival grafting. And its features include similar in overall appearance to cotton pliers. Basically, it is similar to the cotton pliers, our normal pliers which are being placed. Uh, so it is similar to that. Various serrated tips for securely grasping tissue flaps. You can see that there are serrated tips in the its working end. They are used for securely grasping the tissue flap so that the tissue flaps can be securely grasped and they can be used any surgical procedure requiring incision and suturing. Then there is Ellison tissue forceps. You can see that what is this is the Ellison tissue forceps. Its function is also to grasp and stabilize soft tissue flaps during the suturing and reconstructive procedure like gingival grafting. It features include hemostat type handles. It can be also used for clamping the large blood vessels so that the blood can be stopped. And serrated tips. It also has serrated tips basically, and it can be also used in any surgical procedure requiring incision and sutures. Now coming now coming towards the extraction forceps, there are different extraction forceps being used in the industry. One is of maxillary anterior and premolar. Its number is 99. This can come in your exam viva. So function is to remove the teeth from the bony socket. Basically, it is used for removal of the tooth from the bony socket, as in this picture you can see. This is moving the basically the canine, maxillary anterior. In this picture, the beaks are being holding the tooth here, and it has the straight right angle beaks, straight handle beaks. The beaks are basically straight and they are a little bit angled. And what is doing? The beaks designed to conform the facial and lingual root contour just apical to cervical line. Okay, so here you can see that the beaks are going beyond the cervical lines and it is holding the root as well as a little bit crown and root portion so that it can extract the tooth easily. And universal both peaks same design fit equally well on the facial lingual for right and left quadrants. So beaks are a little bit straight and a little bit the contra angle. You can see that, and they are used from the extraction. Okay, now this was our maxillary forceps, extraction forceps, anterior used for the anterior and premolar. Then we have the extraction forceps number 150 cries, maxillary, anterior, and premolar. Its function is to remove the tooth from the bony socket. So its peaks are designed to confront the facial lingual root contour just apical to cervical line. You can see that its shape. You can its shape is little bit different from the previous one, and its maxillary counterpart to the 1-5 mandibular in his in his it is universal and it has both peaks same design fit equally when facial or lingual light. Now the next picture includes this uh, extraction forceps. So what is extraction forceps number 18 are maxillary right and first second molar. Basically it is used for the removal of the first and second molar. It has rounded beak contours. The each beak has different design to adapt to maxillary molar roots that differ in anatomically to facial lingual. Basically, the beaks of the maxillary molars are different in the shape, so the beaks are rounded to adapt them. And the pointed beaks contour to bifurcation of mesial buccal and distal buccal root of 18 and 15L are essentially the same instrument on except one has curved handle while with the both angles are straight on the. Basically, you can see that they have some pointed needles as well. The pointed needles are used for the in bifurcation areas as well. Then there is expression force number 15 3 are maxillary right first and second molar, and it has bayonet design. You can see that this is a bayonet design, and they are also removed used for the removal of the tooth from the bony socket. They have a rounded beak contours to the lingual root. Each beak has different design for the adaptation. Okay. Now the same as the earlier extraction forceps, they are used for the removal of the bony socket. ठीक है. Beak with one projection contour the bifurcation of mesial buccal, distal buccal roots. Beak with two projection contour the lingual root. So basically, you can see that this there is a sharp bending here, and this is known as the Bionic design, and it is used in the lingual roots in the bifurcation area. Now moving towards our next one, this one is the same. And for the removal of the maxillary third molars, we have also Bionic design. Same, it used to remove the tooth cervically and apically. You can use in both quadrants and extraction. For the removal of the uh, tips of the roots, we basically use this one, extraction forceps and maxillary and mandibular overlapping anterior root tips. To remove teeth, tooth fragments and root tips from the bony socket universal, they can be used in both quadrants because they fit easily well on the facial and lingual extraction. So you can see that these are very much common for the removal of the roots of the tooth. In mandibular root tips, you can see that this is a forceps which is being most commonly used. So to remove that tooth fragments and the root tips from Loni socket, it is bird beak design. Basically, it is like the shape of the bird beak, 7-4, and it is used for dissection. Now then we have all deciduous teeth and removal. For the removal of deciduous tooth, we have this one. It is smaller overall. Its beak is a little bit smaller from the mandibular permanent anterior remover. Uh, Now it can be used in universally in the both quadrants as well. So in the end, we have this one mandibular anterior premolar to remove the small teeth from the bony socket. It is like this quadrangle shape, and it can be removed used for the extraction as well. Then we have crier, which is used to remove the teeth from the bony socket, and it is it is this shape. Okay, now this one. This is the cow horn. The forceps is a very much famous. Why it is called cow horn? Because you can see that its beak are like the horn of the cow. Uh, they are used to contour the bifurcation of mesial and distal root pointed beaks, basically, and the beaks designed to conform the facial lingual root contour just apical to cervical. They are also used to remove the tooth from the bony socket. So you should remember that cow horn are basically used in the first and second molars, mandibular second molars. So always this can come in your MCQ. Cow horn forceps are used for the bowl of the mandibular first and second molars. Extraction forceps includes the Bionic design as well, and it can move from both ways from the bony socket. Then we have surgical handpiece. You can see which is used for the removal of the bone or which is used in surgical infection of those to replace implants, remove bone, section teeth. Okay, this is a surgical machine handpiece. Old sterile water and equipped with the pump or irrigation with the both straight and quadrangle handpiece designs are being used. And we have laser. Laser is being also used light amplification by stimulating emission of radiation to remove the soft tissue with minimal discomfort and bleeding. Whenever we need to remove any soft tissue with minimal discomfort and bleeding, we require laser. Laser also has a bacterial effect for enhanced wound healing. This is one of the advantage. Application includes splenectomy, excision of lion gingivoplasty. We can do splenectomy with the laser, excision of lion's gingivoplasty, and crown lengthening or root canal therapy with the help of laser. So these are some of the advantages. The clinical application includes laser. Laser being is a hazardous to eyes and the skin. Patient operator and assistant must wear special protective goggles and keep hands and body parts away from the beam. Non-shiny instrument should be used to avoid deflection of laser energy. Smoke plump forms as tissues vaporize. Use high volume evacuation during the procedure. Okay, this is basically the light amplification by simulation emission of radiation laser. End audience implant fixture. You can see that end audience implant fixture to provide a route from the replacement of the missing teeth. Cylindrical Q-shaped device made of titanium alloy. Basically, it is made of titanium alloy. It is cylindrical shaped and embedded within the alveolar bone. Basically, it is embedded within the alveolar bone, or provides the support for the dental crown on the bridge or denture. Basically, it provides the support for the dental crown, bridge, or the denture. It is cylindrical shaped, screw shaped device. Cylindrical screw shaped device. Cylindrical screw shaped device. It is made of titanium alloy. Provide a root form for the replacement of the missing thing. Basically, it provide root form for the remaining teeth. Now coming towards surgical implant site preparation kit. So this is basically preparation kit you have encountered in various institutes and different places. It is used to remove and fix shape the bone for placement of implant fixture. Feature includes multiple drills are being carried out according to shape and sizes of the implants you need to carry out. Basically, incision is given and a tissue flap is attached to expose the alveolar bone. As you can see that an incision is being given in the bone and the tissue flap is being detached to expose the alveolar bone of the implant site. Next, a surgical handpiece is used with the implant site preparation kit to shape a hole. Basically, a hole is done with the help of a surgical handpiece, and so for the implant fixture, then the implant fixture is played and covered with the soft tissue flap. Basically, this is basically the implant preparation kit you can see there. Now, implant wrench driver. Basically, it's something to play implant screw on the healing abutment on the implant fixture. So it helps in placing the implant screw or a healing abutment on the implant fixture. Clinical lifting in the healing abutment extends over the oral mucosa. After the implant is stable and integrated together with bone, the top of the implant is exposed and the healing abutment is placed. The gingiva heals and grow around the abutment, creating the aesthetic gingival margin for the future implant crown. So this is basically the function. It is used for placing the screw or abutment of the implant screw. Then we have basic instruction setup, which is being commonly used in the all your wards and all your surgeries. It includes local anesthesia syringe. This is the local anesthesia syringe and the cartridges setup, needles and cartridge. It includes needle, cartridges, and gauze. Then we have sterilizer gauze here. Then we have a surgical aspirating tip as here, and we have a four cotton plier is being placed here as well. Five is the mouth mirror. Six is periosteal elevator. Seven is straight elevator, and eight is the surgical aspirating tip. Then we have Sorry for the disruption of internet. The lecture was being completed, and if there is any doubt, you can ask me in the comment section. I hope so. This lecture was being useful for you guys. Sorry for an extensive lecture because it need to be explained very well to you guys so that you can ace with very good marks in exam. I hope so. It was useful. There was a question asked in the chat. Is there any other types of the periosteal elevator? There are a lot of being uh, types, but the main periosteal elevator is there are types of elevator like straight depth elevator. Basically, there is no other type of the periosteal elevator. Just there is a mold. Okay. So thanks for the listening to this lecture very much with the patience. I hope to see you in the lecture number 2, inshallah. Khuda Hafiz.